Hello, this is Akram Jafar and I am the course director and instructor of the Basic Human Anatomy course ANAT1010. This Getting Started video is intended to highlight the main features of the course and show you how to access the online resources and take the online exams. Details of each feature are provided in the course outline file, which is a PDF document that you can download from Brightspace. Also, the details are present within each section in the course website on Brightspace. For online students, you will notice that although all course files are available and you are not required to classes, the course is not completely self-paced. In other words, it is necessary that you follow the study plan which is suggested in the course outline and manage your time to submit the required assignments. This course has 3 platforms. The main platform, in fact, is Brightspace. First, this is the Dalhousie University website from which you can log in to Brightspace with your username and password, and then select the course from My Courses. So this is the Basic Human Anatomy course. First of all, check out the home page for announcements. At the moment, the only announcement is about copyright disclaimer, but you should keep in mind that it's your responsibility to keep up to date by setting up Brightspace to receive notifications. You can set it up from here, Notifications. You will find that there is another way of keeping up with the course by downloading the WleyPLUS app. You can download it from both Google Play and App Store. It will help you stay connected with your Brightspace courses and you can set instant notifications. After that, go to the course content and you will find that there are many entries here in the table of content. I would highly recommend that you take the tour of the course tests on Brightspace to ensure that you are familiar with this course regarding resources, scheduling, examination questions, grading, accessibility services, bonus activities, integrity, and exam policy. It is recommended that you take the tour after watching the Getting Started video or after reading the course outline. Here's the course outline. You will find it with the course information and you can download it as a PDF document. Please note that you may take the tour of the course several times and review the incorrectly answered questions. To start with, find the course files, and these are located in the PowerPoint Lectures section. You will see here that the section is divided into 3 blocks. In fact, this is the main framework of the course. There are 3 blocks, and after each block, there is a midterm examination. So block 1, as you can see here, is about general histology and the integumentary and musculoskeletal systems. The lectures are located here as PowerPoint presentations. You can click on the lecture to study it as a PDF file, or it is actually preferred that you download the lecture. When you download the lecture and study it in the slideshow view, you can benefit from the embedded features that are present in the lectures, such as the links that are available on the slides and animations. For example, here you can find a link to the screencast lecture that is related to this video.
Okay, so good afternoon. Welcome to the Basic Human Anatomy course.
Also, you will find some optional videos. For example, here is an optional video on the anatomical position.
I'm going to recommend a patient for surgery by telling the surgeon that the patient has an achy belly. They're going to need to give a detailed description. Essentially, it's like a verbal map.
You will find that with each lecture, there is a due date here, or going back here, due date. These due dates are added for lectures to make them appear in Brightspace calendar, and this will provide another way of tracking the course. There is no action needed from your side apart from downloading the lecture, studying it on the same day so that to avoid cramming and to have a chance to participate in the iClicker Reef questions for bonus marks. Also, in addition to the link to the screencast lecture that was available on the lecture itself, you will find the link here again to the screencast lecture that is related. And again, here you will find the objectives and a note saying that use the PowerPoint lecture in the slideshow view to take advantage of the embedded features. This is about the PowerPoint presentations, and then we have the virtual anatomy lab videos. Here are the virtual anatomy lab videos. Again, block 1, block 2, and block 3. And this is a description about these videos. These videos were produced by my colleague, Dr. Gary Allen. Not all the lectures studied in this course have a lab component or a lab video. So for example, let's say in block 1, which has almost 13 lectures, there are only 6 labs. So you can access the lab video from here. So this is the video on the axial skeleton.
Hello, I'm Dr. Allen. Welcome to the Anatomy Lab. In today's lab, we'll be looking at the axial skeleton.
There is also an indication that there is a video in the related lecture. This is the related lecture, the axial skeleton. You will find that in slide 1 there is a link to the screencast lecture, and then in slide 2 always you will find the objectives, but in cases where there is a related lab video you will find that there is an indication here. Also, in order not to miss these labs, if you go to the PowerPoint lectures again in block 1 and the lecture which is related to the axial skeleton, and you open this lecture, you will also find that in addition to the screencast lecture there is a related lab video and the link to the related lab video as well. So take notes while you watch the video, and after you watch the lab video it is recommended that you use these self-assessment lab questions. Related self-assessment lab questions, you can access them from here, or you can access them from here from the lectures, or you can access them from the lab section. I will go back to the virtual anatomy labs. Here we are, block 1, and you will see that, for example, with the axial skeleton video, there is an axial skeleton self-assessment presentation. Again, you can download this presentation and use it as a PowerPoint file, and this PowerPoint file is better presented, as you can see here. Use the slideshow view for proper viewing of the features. So I'm going to use the slideshow view. Again, it has the link to the related video and the objectives, and you will see that it is an interactive presentation. That's why it's better to use it in the slideshow view for proper viewing of the features and to help you test yourself while identifying the labeled structures. So when you click or you tap on a box, the structure will be identified, and that's why you can use it for self-assessment. Here again, for example, this bone is the zygomatic bone, and you will find that there are many other pictures or diagrams in the same way. These are the structures that are required to be identified for virtual lab exam. And the virtual lab exams, they constitute 20% of the total mark in this course. You can see here when I go to assessments, apart from practice tests that I'm going to talk about, the exams are set in 3 blocks in addition to the final examination. And for each block, for example here, block 1 exams, there is a midterm and there is a lab test. And these lab tests, there's 5% for the lab test 1, there is 5% for lab test 2, and 10% for lab test 3. You'll see here, for example, in the lab test 1 is 1 hour, 30 questions, constitutes 5% of the total mark, and this is the time of the exam, and this is the availability of the exam. So lab tests, they constitute 20% of the material, and the questions are based on pictures that are derived from the lab videos, the pictures that are derived from the self-assessment PowerPoint presentations, and from the PowerPoint presentations themselves as well, and from the textbook. So all the questions in the lab exam are based on pictures, but they are integrated with the theoretical lab material. Pictures are not used in the midterm or in the final, only in the lab exams. Returning back to the self-assessment files, you will find that if I don't show the file in the slideshow view, then all the labels will be revealed, and I will not be able to use it for self-assessment. These virtual lab assignments you are not required to submit, and if there are due dates attached to them, then they are just for you to schedule your studying. You are not required to submit anything, since they are not like the weekly WileyPLUS assignments that I'm going to talk about in a moment. Now, going back to Brightspace, the weekly WileyPLUS assignments, they are located in the second platform, but here you can see that there are some details about how to log in into WileyPLUS, how to create an account. Also, there is the assignment schedule, which you also find it in the course outline. And there is a short video here on how to complete a WileyPLUS assignment as well. Also, you'll find more details in the course information here. WileyPLUS, find and register your course. This is how to sign up for a WileyPLUS account. And this is the 6-digit course section ID that will be required from you to enter. Here's a flyer of how to register and a walkthrough tutorial video as well. Now let's go to the WileyPLUS platform. Log in to WileyPLUS using your username and password. This is the home screen here, in which you can find the assignments also, or you can access the assignments from here as well, from the assignments tab. Also, you can go to grades, to your grade book from here, from grades. So no assignments have been done yet. That's why you don't have scores for these assignments. If you want to go to the textbook, then you will go to the Wiley course resources, and then the WileyPLUS e-textbook. So when you go to the e-textbook contents, you can move to any chapter. For example, here the chapter on tissues. You should keep in mind that the textbook contains a lot of information, interesting information, applications, and clinical cases. You're not required to study all the material that is present in the textbook. What is required from you is that you study the material that is present in the PowerPoint presentation, in the virtual lab videos, and the lab self-assessment assignments. Now, the second thing to look for on WileyPLUS is the assignments, and these are weekly assignments. I will go to the assignments here. They constitute 20% of the course total mark, and they must be completed before the due date. Otherwise, there is a late penalty of 50%. So each assignment, as you can see, it has a title here, and the title is the same as the title of the lecture. And you can see that, for example, the introduction lecture assignment is available until December 15, which is the date of the final examination, but it is due on September 13th at 11:59 p.m. Each assignment consists of 25 to 40 questions. So you can see here, this assignment, the introduction assignment, has 30 points, which means 30 questions. There's 1 point per question. And you are required to submit the answers before the due date to avoid the penalty. Please note that the penalty does not apply for assignments of the first block. So these are the assignments of the first block until we reach the nervous tissue assignment, which is the first assignment in the second block. If you click on this assignment, you will find that there is a note here saying a late penalty applies if submitted after the due date, while a penalty does not apply for the assignments of block 1. There is no such note here, for example, on the assignment on cells, which belongs to block 1. Let's go back to the first assignment, the introduction assignment, and try to do the assignment. The technical team at WileyPLUS recommends that you use Chrome as your browser when you use WileyPLUS, and this especially applies for students using the Mac iOS devices. Now let's do the first assignment, the introduction. We open the assignment. As you can see here, there are 30 questions, as you can see, 30 points. The assignment is due on September 13, 11:59 p.m. It will be available until the day of the final examination. And you will find that there are 2 attempts allowed for each question. Now let's open the assignment. A system in the body is composed of related space with a common function. And so a system in the body is composed of related organs. Okay, and then I will submit the answer, and you will find that the background is green now. Your answer is correct. Now I move to the second question. The question says, when the human body is in the anatomical position, the palm of the hand faces where? Forward, laterally, medially, posteriorly, or superiorly? Now the answer is forward, but I will try to enter an incorrect answer. So I will say medially, and then submit the answer. You will find that the background is pink, but still I have used only 1 attempt of 2. So in this case, I either go back to my PowerPoint presentation, and we'll go to the section on the anatomical position, and this is said that the anatomical position is the standard position from which to describe directional terms: standing upright facing the observer, eyes facing forward, feet flat on the floor, arms at the sides, palms turned forward or supinated. So it should be forward. The other option that I can do in this case is to go to the e-textbook and media, and this link will take me to the related section directly. So you see here that I was taken to the section on the anatomical position, and here in the anatomical position the subject stands erect facing the observer with the head level and the eyes facing directly forward. The lower limbs are parallel and the feet are flat on the floor directed forward. The upper limbs are at the sides with the palms facing forward. Okay, so I will go back and then correct my answer forwards and then submit the answer. Now my answer is correct. Then I move to the next question. If I am not able to answer this question at the moment, or I don't have time to finish my assignment at the moment, I can save it for later or just leave it as such. Now you can see that I answered 2 questions and I got 7% of the total mark, but I can come back and finish the assignment until 11:59 p.m. on January 11, the due date. Now after finishing the assignment, I will go to the gradebook here just to make sure, and here I am. In the introduction I have 2, okay, and these are the other assignments that I haven't done yet. So make sure that your score will appear in the gradebook after you finish the assignments. These, at the end of the course, will be exported to Brightspace and will be added to your exam marks on Brightspace. Again, I repeat that these assignments that appear here, they are required assignments. They constitute 20% of your mark. WileyPLUS itself contains optional assignments. These are called adaptive practice assignments. And if you decide to participate in adaptive practice assignments, you can get a bonus mark of up to 5%. They can be accessed from the assignments tab. The list is just below the list of the weekly assignment. You can read about these assignments and the course outline or on Brightspace. You will notice here that these assignments, they don't have a due date, and they are open until, as you can see, until December 15, which is the day of the final examination. They are not limited in number. Like in the weekly assignments, I said that there are 25 to 40 questions each, but here the number is not limited. That's to say, the adaptive practice assignments are personalized. They are customized based on your performance. That's the reason that they are called adaptive practice. I'm going to access, for example, the adaptive practice assignment on the heart. So no due date. It's available until December 15 at 11:59 p.m. And then we open the assignment. For the first time, there are brief instructions you will go through and then get started. So estimated 16 to 40 questions, 10 points are possible, and this is the progress bar. You will see that it will be shown when I start the assignment. It will be shown on the upper right hand corner. So here, the receives oxygen rich blood from the pulmonary veins. That should be the left atrium, and then submit the answer. The answer is correct. You can see here that there's some sort of progress. I will continue. The membrane that surrounds and protects the heart is the pericardium, and then submit answer. You are correct. And you can see the solution here. The pericardium is a membrane that surrounds the heart, and so on. Which is the difference between male and female heart? Force of contraction, fat content, size, contraction rate. It's the size. Submit answer. Continue. You can see the progress now is 25%, but I'm not getting any points because grading is based on 10 points for each chapter assignment, and the grading system is set so that you will get 0 points if your progress level is less than 40%, and then 5 points if your progress level reaches 40%, 7.5 if 60%, and 10 points if the progress level is 75%. I will continue with the questions until at least I reach the 40%.
With regard to the surface projection of the heart, the inferior right point is located at the superior border of the 6th right costal cartilage. Correct, continue. Is the study of the heart. So that is cardiology.
You see now 40%. I reached 40%. I can leave now. Okay. And we'll go to gradebook. Scroll down until reach the adaptive practice assignments here for the heart. You see that now I got 5 points because I reached 40% progress, 40% efficiency. Okay, and then I can go back and continue with the assignment at any time. Please note that if you start answering questions incorrectly and your progress bar starts moving in the other direction, you will still earn the points based on the furthest progress you have made. I will go back to the adaptive practice, not the weekly assignments. Adaptive practice on the heart, this one, and then open. See here, this is my progress. Continue the assignment. Continue here. The mechanism of closing a semilunar valve is a decrease in ventricular pressure, an increase in the atrial pressure, a decrease in the atrial pressure, an increase in the ventricular pressure, a decrease in the ventricular pressure. Continue. Now I am 47%. The receiving chambers of the heart are the atria, plural of atrium. Now I am 54. Blood that enters the heart via the superior and inferior vena cava enters the atrium, flows through the tricuspid valve, enters the ventricle, then pass through the pulmonary valve. Submit answer. I am almost approaching. The coronary sinus empties into the right atrium and is located on the posterior surface of the heart. And now I am 77%. Score updated to 10 points, 10 out of 10. Okay, so now you can either continue or you can go and leave the assignment, check your grade again, and here you are, 10 points after you reached 75% proficiency. The third platform which you can access online is the iClicker cloud. Again, you can go to Brightspace and here iClicker cloud and the course content. It will give you information of how to register for the iClicker cloud account. Join ANAT1010 Section 2 Winter 2023 at Dalhousie University. Join code 3LS26. If you already have an account from another course, you can simply log in, but if this is your first time utilizing iClicker, you need to click on the sign up item and enter the institution, Dalhousie University. Set your password by using the same name and email address that you used in Brightspace and in WileyPLUS when you sign up for iClicker to avoid grading concerns. The assignments are scheduled, and you will be able to locate this under the assignments tab, as you can see here. It will show the current assignments on the day of the scheduled lecture, and then you can see the past assignments later on after that. So you have to access the assignment on the day of the lecture from 12 a.m. to 11:59 p.m. Otherwise, you will find the assignment in the past assignments. You can use it for review without grading. Keep in mind that you will get 0.5 mark for participation and 0.5 mark for correctness. At the end of the course, there are 132 questions, and they will be counted out of 5. And this will be considered as a bonus mark to be added to the adaptive practice if you participated in the adaptive practice. But in all cases, the total bonus mark cannot exceed 5, even if you aced them both, the adaptive practice and the iClicker questions. And you can see here, for example, that in each lecture, you will find that in some slides there is the iClicker logo, which means that at this point you are ready to answer this question on iClicker if you are an online student. And if you are attending the class, then you would expect that after this slide, the instructor will show the questions, so you have to prepare your devices. Now let's deal with the exams. Here you can see some details about the exams. Exams are open book, online exams, but collaboration is absolutely prohibited in the exams and in the assignments. And it is recommended that you don't fall into the misconception that open book exams do not need any preparation. In fact, they require a lot of preparation, but you need less memorization because you might go back to your notes. So you need to study, but you don't have to memorize as much information as you will need for the closed book exam. There are different types of questions, like multiple choice questions, select one of the most appropriate, or multi-select questions, multiple selections, matching questions, and ordering questions. There are 3 midterm exams. Each one of them has 45 questions that should be done within 60 minutes. And there's the final exam, which contains 90 questions that should be done within 2 hours. There are no alternate exams for students who do not do as well as they expected. And if you have any internet problem you encountered during the exam, immediately take a screenshot of your screen with showing the error and the time, and then contact the instructor via email attaching the screenshot. All exams will be available throughout the day of the exam from 12:05 a.m. until 11:55 p.m., of course Atlantic time, and the exam password is always ANAT. The final exam will be available for 2 days. Before doing the exams, try to do the practice tests. Here are 2 practice tests from the assessment. You go to them. The first one shows questions that are similar to the questions of the midterm. So the practice test will not count towards your grade. And the password is always ANAT, as I said. I will start the practice test. So again, you will find that there are some notes here about the practice test, which is not counted towards your grade. These are the details, instructions. Before you submit the quiz, you will have the opportunity to return to questions that you may have missed or have not yet answered. And once the allocated time period that was set for the quiz expires, you are required to submit your quiz responses. Then start the quiz. You will see that there is a timer here. So this is one type of questions, is the matching type of questions. Match the directional terms with their description. Distal is away from the trunk, so it's number 8. Posterior is toward the back of the body, so it's number 5. And then next. And this is the second type of question. Choose the most appropriate answer here. Which of the following muscles does not exert a force on the upper extremity during contraction? Which means that I'm looking for a muscle which does not belong to the upper limb. And the pectoralis major belongs to the upper limb, so as the triceps brachii. The only muscle here is the biceps femoris muscle. So I'm clicking on the biceps femoris. Only one choice because I have these circular radio buttons. And next page, which is the next question. This is another type of question, which is the ordering question. When a macrophage digests bacteria, the process of cell eating takes place in the following order. So the first thing is that the pseudopods extend to surround the bacteria. No, bacteria bind to membrane receptors, and then pseudopods extend, and then phagosome is formed, and then phagosome fuses with the lysosome, and then the lysosome digests the bacteria. Next. Here again, we have choose the most appropriate, single choice, because I have the rounded buttons, radio buttons. The antebrachial region refer to the forearm. And then next. I will skip this one. Next. This is matching. Next. This is again, select the most appropriate. I just want to show you the other one here, which is select all choices that apply. This is the fourth type of questions that you will be faced. You should be careful in these types of questions because wrong answer deducts a penalty. So like joints that allow flexion and extension movements include the interphalangeal joints. Flexion extension also is in the shoulder joint. Radio-ulnar joints do not. Atlanto-occipital do not. Metacarpophalangeal, yes, they allow. So 3 of them. And how I know that I have to select all choices that apply, first of all, there's an indication here that I select all choices that apply. And the second is that the buttons are square buttons. They are not circular radio buttons. Now, next page. And suppose that I finished the quiz by now, so I submit the quiz. This will show me the questions that I didn't attempt to answer, and I can go back and answer them from here. But if I'm done, let's say in the actual quiz, then I will submit the quiz, and now I'm done. Now let's take another practice test, which is a practice lab test, so that to have an idea about type of questions that are given in the lab tests. So start quiz, and you see here that there are pictures. For example, identify the type of bone indicated as A. It's a sesamoid bone. This is a single choice. Look at the radio buttons, rounded. And here, which of the following is the umbilical region? It should be D. Next page. Next question. Here, this is select all choices that apply. So the dissection shows which of the following muscles. Does it show latissimus dorsi? I cannot see latissimus dorsi. I can see deltoid here. I can see not brachioradialis, but I can see pectoralis major muscle. Brachioradialis is in the forearm, and I will not be able to see it. And I can see this rectus abdominis muscle, the muscle with tendinous intersections. So 3 of these muscles can be seen. Next page. Again, this is choose the most appropriate, and then choose the most appropriate. All of the questions are based on dissections, pictures, screenshots from the videos, but you need not only to identify the structure, but also you need some theoretical background. So for example, here, I know that this muscle is the frontalis muscle, but the question is, what is the action of the muscle indicated by the pointer? And the action is that it wrinkles the skin of the forehead, this one, not the lateral angle of the eye, the skin of the forehead. Next, and so on. Here you can see this is a picture, a screenshot from one of the videos, Dr. Allen's videos. Again, I repeat that the work in the tests and the assignments should entirely be yours, and you shouldn't violate the Dalhousie academic integrity policy, which is mentioned in the course outline. And then you should not give nor receive any unauthorized aid when taking the examination. Collaboration is absolutely prohibited. Another optional activity is the Human Anatomy Education page on Facebook. So when you navigate the page, you will find that the page supports teaching, but it will not replace any of your lectures, and you wouldn't be graded for your engagement on the page. The themes of the posts are humor, news, questions. Many of these questions are related to anatomy, but are not necessarily matching the level of your anatomy course. But in that case, if you want to search questions that are related to your course, then you can use hashtags. So if you search the page using hashtag ANAT1010, then you will find all the questions that are related to ANAT1010. Or if you want to be more specific about questions related to block 1, let's say, so you can use hashtag block 1 or hashtag block 2 or block 3. Finally, here's my email address, and I also encourage you to communicate questions, problems, and concerns either by email or by posting the question on Brightspace discussion board, or you can send me an email request to set you up for a meeting, either face-to-face meeting or a virtual meeting. So in your email, please suggest at least 2 times that work well for you for the meeting. And if the meeting is a virtual meeting, then go to Brightspace, course content, and then course room. Here, this is the where you go to Collaborate Ultra. And this is the ANAT1010 course room. Click on that and then join the course room. You will either find me there, or you can just wait for a couple of minutes until I join the session. And finally, I'm eagerly looking forward to working with you this semester. Thank you.